my PhD thesis on novel devices in the rehabilitation of children with cerebral palsy. My name is Mátyás Vezér, and I work at the Department of the Orthopedic Clinics. And I choose this topic because my vision is strengthen the faith that quality of life of children suffering from cerebral palsy can be improved by novel rehabilitation methods. And my mission is to clarify the indication and roles of innovative methods in the rehabilitation of children with cerebral palsy. Let me introduce my two ongoing projects. First of them, the effectiveness of robot-assisted gait training on gross motor function in children with cerebral palsy. It's a systematic review and a meta-analysis, which we have started in 2021, 1st of September. So, cerebral palsy occurs by the damage to the developing brain, which may cause movement disorder. Its incidence from 2 to 3 out of 1,000 live births. In ambulatory children with cerebral palsy, improving gait is in the main focus, and regular monotone rehabilitation is a part of the patient's everyday life, and robot-assisted gait training may bring a touch of excitement in this monotonity. So there is no existing evidence that robot-assisted gait training would be better than the conventional therapy, and our aim is to provide a higher evidence of this treatment. So our clinical question is, can robot-assisted gait training improve gross motor function in children with cerebral palsy? Our population is children with cerebral palsy, intervention robot-assisted gait training, comparator conventional therapy, and outcome gross motor function measure 88 and 66. Our hypothesis is robot-assisted gait training is associated with better gross motor performance in cerebral palsy. Our clinical implication could be an optimal insertion of robot-assisted gait training into the routine conventional therapy of cerebral palsy. So we have done the systematic search in 2021 October with these 5 databases and with that search key. We have found 7,366 articles. From that we have removed 1,006 during the duplicated removal, and after that we have done the title and abstract selection with a Cohen's kappa value of 0.89. And at the end we have found only 12 articles for the data extraction. Now we are ready with the data extraction. My second project is the efficacy of video game-based therapy to improve upper limb function in children with hemiplegic cerebral palsy. It's a systematic review and a meta-analysis, which we have started in 2021, October. So approximately from 20 to 30% of individuals with CP are hemiplegic, and hemiplegia is a unilateral paresis which affects the upper limbs more severely than the lower limbs. Children with CP usually have a variety of motor impairments of the affected upper limbs, such as muscle weakness, spasticity, and incoordination, which may result in dramatic function loss, for example, reaching and grasping. So video game-based therapy thought to be as effective as usual care or conventional physiotherapy. Therefore, better rehabilitation results can be achieved through increased compliance. Comprehensive studies regarding the effectiveness of video game-based therapy in upper extremity rehabilitation in children with CP are limited, and our aim is to prove the efficacy of video game-based therapy. So our clinical question is, what is the effectiveness of video game-based therapy on upper limb function in children with hemiplegic cerebral palsy? Our population is children with hemiplegic cerebral palsy, intervention video game-based therapy, and comparator conventional therapy, physical therapy, or absence of treatment. Our outcome, gross manual dexterity, grip strength, or manual ability classification system. And our hypothesis could be in hemiplegic cerebral palsy, video game-based therapy is associated with better outcome of upper limb movements than the conventional therapy. Our clinical implication could be a better treatment method to improve hand function. So, our planned submission date for the first project is 2022 May and 2022 July for the second project. I would like to say thank you for your attention.
Thank you for your presentation. Can you tell us how we can imagine this video game therapy?
Yes, of course. Thank you for your question. Video game-based therapy include motion-controlled video games, for example, which you can use with Nintendo Wii, and also with controller remoted video games, for example, Xbox 360.
Congratulations for your topic. I'm really interested in this video game. What may this video game may add to the therapy?
I think if it can be as effective as usual care, it has got an increased enjoyment factor, and with that it can increase the compliance of the patients.
Congratulations on your presentation. I would like to ask a question regarding to your second PICO, yes, where the C was conventional therapy, physical therapy, or absence of the treatment. Is there any articles that are mentioning all three therapies?
No, we haven't found that. If
okay, then how is your plan to compare in your meta-analysis?
Most of them, they use a conventional therapy or a physiotherapy, and we would like to focus in these two comparator mostly.
Okay, thank you.